Welcome to the 151st edition of the Diabetes Chai Chat. I just can't believe that we've been going for 151 weeks. That's almost 3 years. The topic today is going to be managing acute heart failure, symptoms, diagnostics, and treatment. I hope everyone has their chai. I have got my chai from Chaiwala on Belgrave Road. I asked them not to put any sugar in because they keep doing this, and my blood sugars go very high. Welcome to our resident doctor, Dr. Hina Trivedi. Welcome to you from Leicester. And Ishan Rahat, the diabetes specialist in Dhaka, Bangladesh. Our guest speaker today is Dr. Rajiv Sankaranaran, the consultant cardiologist and heart failure lead for Liverpool University Hospital's NHS Foundation Trust. Dr. Rajiv studied medicine at the Rajiv Gandhi University of Health Sciences in Karnataka in India. He completed his cardiology specialist training in Northwest England hospitals at Manchester Royal Infirmary and Blackpool Victoria Hospital and obtained his PhD from the University of Manchester. He is currently the clinical lead for heart failure at Liverpool University's Hospital Heart Failure Services and the lead heart failure National Pathway Improvement Programme. He received the National Roy Award in 2018 in recognition of his services towards heart failure patients, including developing the now famous HF mobile app. It is an absolute pleasure having you on, Dr. Rajiv. The normal format is you have 15 minutes to give us a presentation, and then the questions have already come in. We'll have some questions to you. So I hope that's all right. Welcome. The floor is yours.
Perfect. Thank you. Thank you very much, Keith. Thank you. I'll just share the screen and please let me know. I've got a message saying host has disabled participant screen sharing. So if you can enable that for me, please.
Yes, it's done, Dr. Rajesh.
Okay, I'll just try again, please. Okay, if you can tell me, can you see the screen now? Can you see the slides?
Yes.
Yep, perfect. Okay, thanks. Thanks. So I've got a few roles in heart failure, but I'm also, I do a lot of research. So I'm with the NIHR, so a lot of evidence base for heart failure. So Hanif was telling me it's a mixed audience. So I'll talk around some of the slides, but I'll start off by focusing with detecting and managing acute heart failure. So I'm based in Liverpool. But I have a few national roles with NHS England, also with Pumping Marvelous. So it's a heart failure patient charity. So I do a lot of work with them. The British Cardiovascular Society, the British Society for Heart Failure. So just moving on, I'll try covering as much as I can about heart failure itself, but we have also created an app called the Heart Failure Pathway, which is the Cheshire and Merseyside Heart Failure Pathway app. So there's a lot of information available there as well. So what is heart failure? So simply put, it's a condition where the heart's not able to pump enough blood to keep up with the demands of the body. So what do people feel? They can get short of breath, particularly when they walk. They can get fatigue. And a lot of people attribute things like breathlessness and fatigue to just simple aging or putting on weight. So it's a condition which can be diagnosed quite late. They can wake up in the middle of the night short of breath. They can also get swelling of the ankles. So these are some of the common features that they can present with. So we have this, what we call symptoms and or signs of heart failure, but then we need to confirm or refute the diagnosis with 2 further tests. And there's a simple blood test which is widely available in primary care and secondary care, and it's called NT-proBNP. So that test is crucial. And then after that, we do some form of imaging, which is typically an echocardiogram. So I've just put a little video showing the heart where the heart has gone weak and it's not pumping as well as it should. And why is this an important condition? Several reasons, but one of the main issues with this condition is not many people know what it is, like I've explained to you. People frequently confuse this condition for heart attacks, for example. I published a paper about 2 years back with the University of Lancaster and Pumping Marvelous charity. And this was looking at how frequently the public talk about this condition, which is heart failure. So it's not discussed as much as, say, for example, cancer. We compared it to dementia. And then we also looked at how frequently this condition is discussed in Parliament. So we went through all the Hansard records and looked at that. And potholes were discussed far more frequently than this life-threatening condition. And that was quite an interesting thing, because the press latched on to that. But we think about 1 million people in the UK have this condition. It's very underdiagnosed, but so the true number is close to 1.5 million. And along with this, about 60 to 80,000 new cases are diagnosed every year. People are frequently elderly. They have lots of other conditions. Diabetes is one of them, high blood pressure, kidney problems. So, and in a very cost-intense climate that we're in, it consumes a lot of the NHS expenditure as well. And what are the outcomes? Once these people hit a hospital, about 10% of them, unfortunately, do not make it out. About another 6% don't make it beyond 1 month. 30% don't survive beyond a year. And about half the people who are diagnosed, so 45 to 50%, don't make it beyond 5 years. So the condition has been compared to cancer, and indeed, cancer mortality and is getting a lot better with a lot of advanced treatments. So it is a long-term health condition. So when people have this diagnosis, they started on treatment. So it's like diabetes or COPD, for example. People live with this for the rest of their lives. So it is something which is long-term, and there needs to be a lot of self-awareness as well as to how to manage this condition. So I won't bore you with details. Hanif told me there are a few medical students, so I thought I'll have some slides relevant for them as well. So it's a condition where the heart is damaged. There's a reduction in the amount of blood pumped out, and that triggers what's called as the renin-angiotensin pathway. And that leads to increased afterload and as well as preload, and that leads to sodium and water retention essentially. So what are the diagnostic pathways? Like I said, the symptoms and or signs, we do a 12-lead ECG to detect if people have had heart attacks or any rhythm abnormalities. We do a chest X-ray, and like I said, a simple blood test called as NT-proBNP. And followed by this, it's a simple ultrasound scan of the heart called as an echocardiogram. We also do cardiac MRI and angiogram just to see what the actual cause is. There's a simple algorithm that we have developed with the charity called as Pumping Marvelous. It's called BEAT-HF. It's B is for breathlessness, E is exhaustion, A is ankle swelling. And if people have any of these features, it's just time to tell your clinician, whoever that might be in primary care, and ask for a simple blood test called as NT-proBNP. I'm part of several South Asian groups, and just promoting this algorithm, a lot of people have become a bit more self-aware, and this condition has been diagnosed quite early. And again, I won't bore you with the details. Based on the NT-proBNP result, how soon should somebody be seen? Typically, if it is more than 2,000, they have to be seen within 2 weeks and have their heart scan. If it's between 400 to 2,000, it's within 6 weeks. There are several causes of heart failure. The commonest cause is that the blood supply to the heart is reduced, and that's due to what we call as ischemic heart disease or angina or heart attacks. Hypertension or high blood pressure, about 80% of people with heart failure have hypertension. There are other causes. People can have valve problems. Now, diabetes, about 15 to 20% of people with heart failure have coexisting diabetes. So just simply having diabetes doubles the risk of developing heart failure. So there's a lot of focus on managing the risk factors such as high blood pressure and diabetes, so people don't go on to develop heart failure in the first place. Now, unfortunately, in the hospital, we tend to see people once they get their diagnosis, and when we pick that up, it's much harder to manage compared to preventing the condition in the first place. So our focus has shifted a lot towards prevention, while we continue to improve management of the condition itself. I won't bore you with these things, but in terms of the types of heart failure, there are two main types where the pumping action of the heart is reduced, or heart failure with reduced ejection fraction. Heart failure with preserved ejection fraction is that the heart is not damaged. It is still pumping strongly, but it's gone stiff. And the stiffness is classically due to conditions like high blood pressure or diabetes. And these are just two visual representations. On the left, we can see a heart that has been damaged by a heart attack. On the right, we can see a heart that has gone stiff. Like I said, it's a lot thickened as well. And there are lots of treatments for heart failure. So I'll come through to some of them. But because I've been given the topic of managing acute heart failure. So acute heart failure, as the term refers, it's a medical emergency. So treatment has to be started simultaneously while we're waiting for results of investigations. And what we want to see is someone have what's called as cardiogenic shock, where the other organs are not getting enough blood supply from the heart. And if that is the case, these patients have to be managed on either a coronary care or an intensive care setting, where they may require special medications to boost the heart's pumping action called as inotropes. But they also have respiratory failure, as the amount of fluid in the lungs has depressed the breathing capacity. So these patients might require ventilation on an intensive care unit. So if these two are not there, then we can breathe a little bit easier, but look at what has caused this. Is it a heart attack? Is it heart rhythm problems? Is it very high blood pressure? We manage the actual cause. And then we look to see, are these patients wet? Do they have fluid overload? They have fluid in the ankles? Do they have fluid in the lungs? We give them what is called as diuretics, typically as injections or tablets, to get rid of this fluid. So that's the pathway essentially. If they're not wet, if they don't have excess fluid, they're dry, then we look for their perfusion. Are they still perfusing their organs? And then start them on the medications essentially. And there are lots and lots of medications. I won't bore you with the evidence base. We have several medications for heart failure developed over the last 3 to 4 decades. And then the main things that we're looking for are called as the 4 pillars of heart failure. So they're called as ARNI, so angiotensin receptor neprilysin inhibitors, beta blockers, mineralocorticoid receptor antagonists, and SGLT2 inhibitors. Now, these medications, they reduce the risk of dying from heart failure by anywhere from 40 to 50%. But importantly, they reduce breathlessness, allow people to lead active and normal lives as well, and they reduce the risk of hospitalization. So they're very, very important medications. So when we see these patients, not only do we give them water tablets or injections to get rid of their excess fluid, we also start them on these life-saving therapies. So what we've got in Liverpool over the last 8 years, we've developed what's called as an ambulatory acute heart failure unit, where we manage these patients not in hospital. We manage them with outpatient intravenous diuretics, so the injections to remove excess fluid. So we've managed well over 1,000 patients. We've developed 2 or 3 innovations to enable to do that. On the left, you can see what's called as an elastomeric pump. So it doesn't require electricity or battery. We inject the medication, it expands and it delivers the medication, the furosemide, as an injection over an hour. And this can the patients can carry this in a pouch, in their homes. And we also use what's called as point of care blood test as a finger prick, and results are available within 2 to 3 minutes. And using this, we have developed the country's first acute heart failure virtual ward. So this has been running for well over a year. We've managed around 600 patients already. And these are the patients who have access to technology. So this is some of the interface. And this is what we look at when we do our virtual ward runs. We look at all their parameters, their pulse, their weight, their blood pressure, oxygen levels, the temperature. We look at what response they give in terms of how they're feeling on a daily basis. We run this 7 days a week. It's consultant led throughout as well. And they also have access to a daily ECG, very, very similar to what would happen if they were in hospital, for example. And this has been featured on several platforms. The BBC Morning Live came and featured us. So thankfully, because of media coverage, this has now spread, and NHS England has adopted our strategy as a model service, which is to be adopted by other services as well. And we've had a few awards as well along the way, the latest of which is the HSJ Patient Safety Award. And along with this, managing acute heart failure, like I said, people with heart failure also have several other long-term conditions. So they have about 15 to 20% have diabetes, 50% have chronic kidney disease. So we've developed what's called as a multi-morbidity approach. We bring together primary care, secondary care, tertiary care, but a kidney specialist, a diabetologist, chest specialist, geriatrician, because these people are frequently older, palliative care when required, and also a pharmacologist and a pharmacist. So it's a multi-morbidity, multi-speciality team-based approach, because these people have not just heart failure, they have other conditions. I'm sorry about the Liverpool touch there, but essentially it's about working as a team. And this again was a world first approach that we started in about 4 years back, and that was covered by the BMJ, and we received a few awards along the way. But it's about looking at the person as a whole, not just looking at their heart failure, but also managing the other health conditions that they'll have. We've also, as mentioned in the introduction, we developed the first patient mobile app, because it's a long-term health condition. People have to be aware as to what to do, when to present, when to contact the healthcare provider. And what we showed is that by using the app, people are not only more self-aware, they take their medications frequently, and their outcomes are a lot better. They don't end up getting readmitted several times. Now, I'll finish with the acute, but if I can spend another 5 minutes just looking at what are the other conditions. I mentioned to you diabetes, ischemic heart disease, obesity. So the lifestyle factors, there's a lot of focus. I'm involved with the British Society for Heart Failure with the 25 and 25 campaign. And that is the aim of that is to reduce heart failure mortality by 25% in 25 years. And that is by preventing heart failure and managing people with heart failure better. So this is the 25 and 25 campaign in Liverpool. So we look at preventing, look at early diagnosis, detecting this condition where it might be undetected, look at people who have diabetes, high blood pressure, ask them proactively, every time they're seen, ask them, are you breathless? So not wait for them to present to their doctor, but actually go out to the communities. And I do a lot of work in the South Asian community. Like I said, we've started to do a lot of screening, because as we know, South Asians have a high risk of conditions like diabetes, high blood pressure, cardiovascular disease, for example. So just move on a little bit. We've also got a digital health platform. We've got this in Cheshire and Merseyside, but there is talk by the British Society for Heart Failure about developing something nationally. And what we do is we essentially look at people who have these healthcare conditions and see how the treatment of that can be managed a lot better. So that's about using actionable intelligence, using this digital health platform. We've done a lot of public awareness. So I do this with Pumping Marvelous, the heart failure charity. We went around during Eurovision, for example, but went out to the train stations. In Manchester, we went out to places of, where there are religious events, for example, and start asking people about their health, talking about health, where people are in the community, rather than waiting for them to come to us. So we're doing some work with Everton Football Club, again, in areas of deprivation, for example, those people don't go to their GPs. So we use the profile of the club, of the football club, to attract them. So we're going to diagnose COPD and heart failure a lot earlier, but we're using artificial intelligence technology, using echocardiograms, using that as well. So the focus is all about not just better management, but also better prevention, a lot of awareness. So what we should do is, if we come across our own relatives and friends, it's about being self-aware, spreading the message, talking a lot about the risk factors, about these conditions, and accessing healthcare in a timely fashion. Thank you.
Thank you, Dr. Rajiv, for that excellent presentation and for giving us some really important tips about the way in which we should deal with heart disease, especially for those of us who are diabetics. Thank you.